Yes. So Michael Kaldasch is
Yes.
founder and CEO of iMedis, the leading global virtual platform for health education. Michael, please.
Yeah, thank you very much for having me. Hi, guys. Very nice to meet you. A great pleasure to speak in front of you and to present what we do. So as Ed said, I'm Michael. I'm one of the founders of iMedis, and I'm a medical doctor. So I can tell a little bit about my background. I'm a specialist in internal medicine. I was working in hospital for almost 14 years. I was in the pharmaceutical industry for 2 years as a drug safety officer. So I know a little bit about healthcare and about the problems that occur. And based on that information and the problems that we have in healthcare, I don't have to tell you guys because it's everywhere the same. I founded the company iMedis together with my partner Ben, who's also a medical doctor. And what is it what we do? So we have built a medical Web3 platform. Let me share my screen. When I make this full screen, no, that's not.
Okay.
Yeah, let me share the full screen so it's better. All right. So I know this is about AI, so I will come to AI quite strictly forward, but let me give you the frame of the entire topic. So healthcare, what the most pressing problem in healthcare is the processing and the transfer of information / communication. That is the biggest problem in all the fields, either in research, in the daily work, in hospital, and the communication between pharma and researchers, and the communication between insurance companies / payers and patients and doctors. So wherever we meet problems in healthcare, most of them are communication related problems. So what did we do? We said, let's build a platform that tries to cover a little bit of all of these problems and enable different fields of healthcare to communicate in an improved way. Now we have technology, we have the internet, we have things like blockchain, and we said, okay, let's build a platform that makes use of this kind of technology. So we built iMedis as the first medical Web3 health platform that combines digital health applications, so the typical ones like medical records, speaking to a doctor via video chat, prescriptions, etc., second opinions. A professional health platform, which is a basic hospital information system that does not compete with Cerner or Epic or one of the big hospital information system players, but gives a possibility for regions that are not so much industrialized for now and that do not use those super expensive and super deep systems, and also giving it the possibility to work as a tool between something like Epic and Cerner and the patient and the doctor. I will come to that later. Then there is a data exchange marketplace that is also based on blockchain technology that enables patients, doctors, researchers, insurance companies to monetize and mainstream and communicate medical data while keeping privacy, while keeping intellectual property, and while incentivizing everyone in that chain, right? And last but not least, iMedis Avalon, the first healthcare metaverse that is built on Unreal Engine, which is a gaming engine. I will come to that later. So here, I just go quickly through those sheets because I know people hate PowerPoints and they say either I listen to you or I look at a PowerPoint file. So I just fly through this. So this is, as I told you, the digital health platform, which is quite sophisticated in terms of right management possibilities and the option to share data and to not share data with those that you don't want them to be shared with. Data exchange marketplace that uses blockchain technology, as I said, non-fungible tokens and special. What we do not store medical data on the blockchain. We don't, because it doesn't make sense, because you know, the principle of blockchain doesn't make it very practical to store the data, and certain technical advancements, AI is one of them, quantum computing on the other side, might make actual blockchains obsolete. So there needs to be the option to upgrade the system to a newer version or to a better blockchain system in the later stage. So we use non-fungible tokens like a key card to access medical databases. So whatever we do, it's stored in classical medical databases that are HIPAA compliant for the United States, that are GDPR compliant for the European Union. And we have FHIR integrated, FHIR server to communicate the data to professional healthcare IT forth and back. And AMLS Avalon, as you see here, this is one of the actual screenshots, which is this virtual environment that enables all stakeholders in healthcare, patients, doctors, pharma companies, hospitals, insurance companies, researchers, the digital and the retail market for healthcare to have virtual spaces in an environment that compliant with the medical standards, right? Because there are some metaverse that do not work with healthcare because they do not provide end-to-end encryption, do not provide HIPAA compliance, etc., etc. So, and in these spaces that you see here, so this is one space that we made for Sanofi, big pharma company in France, where we enabled them to work a diabetes environment and present it to patients and most like healthcare professionals, which is very immersive. So how does AI come into play here? All the parts of the system, that we have are basically using AI. All right, cool. So AI in all the parts of the system, we use AI either for information and for accompanying people. We are not doing therapy or diagnostics at the moment. Everyone of you knows that AI is already capable of doing that. Especially the latest GPT models are, and I tried it firsthand. You enter a certain information from a patient, lab parameters or X-ray results, and this is just better than most of the medical colleagues that yeah. So for information giving and for accompanying the user inside the system, either in the digital health apps, in the marketplace, and the marketplace also gives an option to users to evaluate data. So we can enter data and we can use the AI to get information out of it. Very simple, right? And inside AMLS Avalon, we have virtual avatars that are using AI that you can speak with. So you can talk to the AI answers you back, which is really impressive. And you can make use of it to navigate through the entire ecosystem. You can make use of it to ask for help, to ask for contact details, to get a guidance. And we also use the AI to evaluate the user behavior inside of this. So we can track where the users are going, what are they looking at, what are they clicking at, what information are they requesting. So that is basically what we use AI for. But of course, also the AI is here to improve the communication, right? That is what AI does. I think very soon we will be able to use artificial intelligence to do real therapies and diagnostics. It's just a matter of time now, and I think it will become a standard way of medical treatment very quickly, because this is proceeding so fast. I mean, imagine ChatGPT, the first version went public end of 2022, and now it's not 2 years. Not 2 years have passed, and this is already impressive, to say at least, right?